Hey everyone, this is Dr. David Clark. Carrick Institute asked me to give another little kind of preview for what the class is going to be like that we're doing in December. And what we are doing is the mastery of the neurochemistry of cardiometabolic disorders. It's going to be December 8th and 10th, 8th, 9th, and 10th, in person or live stream. And what I want to do for a few minutes is kind of, again, dive into what we're doing the class for, why you would probably want to take it, the kind of patients that it would be applicable to. So with that in mind, let's just jump into it. So cardiometabolic disorders, right? Why do we even care? Why should we care about these? Well, let me tell you why. Well, cardiometabolic disorders, you can break that down into cardiovascular, right, and then metabolic. So cardiovascular disorders are things like atherosclerosis, right? A hardening of the arteries, stiffening of the arteries. Hypertension, which of course is high blood pressure. Atrial fibrillation is an example of a cardiovascular condition. Coronary artery disease, where you're starting to get possible ischemia to your coronary muscle. And then we have metabolic diseases, right? Metabolic conditions like insulin resistance, obesity, dyslipidemia, where your lipids are abnormal, whether it's high LDL or low HDL. And sometimes we're talking about the particle sizes, right? Like that's something we'll talk about as well. High triglycerides is another metabolic problem. Inflammation, which could be inflammation from a lot of different sources, could be autoimmunity, could be oxidative stress, could be a mitochondrial problem. That's a metabolic issue. And I mentioned oxidative stress. So cardiometabolic, this is the stuff we're talking about right here, right? So these are the things we're going to talk about in the class, talking about how to recognize them, how to test for them, and how to effectively treat them. Here's all your kind of cardiovascular diseases, right? If you look at the heart attack, stroke, angina, those are the #1 cause of death. They're 31% of all global deaths. These are extremely important to your patient population that you're seeing in your practice, right? They are being affected by this. You and I both know you've got patients right now that are diabetic, pre-diabetic, they're hypertensive, they're dyslipidemic, they're obese, they're inflamed, and it's going to be doing a lot of things depending on their phenotype, right? As I'll show you in a second, it can affect them in a lot of different ways, but there are effective methods, effective things that you and I can do if we know what we've got to treat, right? And what do they do to your brain? Okay, so here we have on the bottom right, we've got our insulin resistance, we've got our obesity, we've got our oxidative stress, we've got our inflammation, we've got our hypertension, our dyslipidemia, our high triglycerides. What does that do to the brain of your patient? Well, first thing it does is it increases the risk of heart attack, which of course can kill you or cause brain damage. The next thing it can do is increase the risk of stroke. And you and I both know there's hemorrhagic stroke, there's ischemic stroke, and they can be very catastrophic strokes. I've done a lot of stroke rehab in my career over the last 20 years. And cardiovascular risk factors are a major, major cause of stroke. And you guys understand that. Hypertension, right, is a silent killer because it usually has no symptoms. So is atherosclerosis. So we need to be able, as clinicians, to be able to be more proactive, right, not reactive. And of course, hey, you've had a stroke, I can do rehab on you, but I would prefer us to try to prevent the stroke in the first place, right? Because all the loss of work, the loss of quality of life. I mean, strokes are can be extremely debilitating. Other thing these conditions do is they increase your risk for Parkinson's, as I'll show. They increase your risk for Alzheimer's. They increase your risk for vascular dementia. And you guys know that Alzheimer's and Parkinson's, the percentages of the population that are going to be affected by that is going up at an alarming rate. And it's not going to get lower because people are getting older. And as you guys know, old age is a major risk factor for Parkinson's and Alzheimer's. But so are these things. These things get worse as you get older as well. So they not only cause these different types of pathologies, for you people that are thinking, well, I don't really want to see Parkinson's patients, I don't want to see Alzheimer's patients, that's fine, because these cardiometabolic problems also accelerate the brain aging of your patients already, right? They make their brains age faster and function worse. They increase the risk for Alzheimer's and Parkinson's. But here's the thing. These cardiometabolic problems, whether it's insulin resistance or hypertension or oxidative stress, they complicate pathological and ablative lesions like the one we're seeing here, but they also complicate and confound physiological functional lesions. So what does that mean? That means if you're trying to do rehab on someone and they're diabetic, you would get a lot better response out of your rehab if they weren't diabetic, or if their insulin was controlled, right? If they were getting normal fuel delivery, right? all of these things we're talking about here, right? The triglycerides, the hypertension, you can think of all that as being factors that are affecting negatively the patient's ability to get fuel and activation to the different parts of their neuraxis. So this is why we as functional neurology, chiropractic neurology practitioners, practitioners in training, this is why we care about cardiometabolic disorders, because there's people in your practice right now that have all of these, and you could be making a major positive difference in their life, not just from a current problem rehab standpoint, but from preventing stroke and heart attack and Parkinson's, and it's a great thing. Here's the big picture, why people like me and you who are in practice, who might be in training, why we want to learn about cardiometabolic disorders now and what we can do, because not only can we go after these kind of root conditions, but we can decrease risk of heart attack, stroke, Parkinson's, these neurodegenerative conditions. We can make our rehab a heck of a lot easier if we're normalizing these factors down here, and we can really be very preventive. So wherever you want to kind of see your role, right? Whether you see your role actively treating people with Parkinson's and Alzheimer's who are going to have these conditions, if you see your role in preventing people from getting these conditions, or if you see yourself as addressing these conditions to make your rehab that you're doing more effective more quickly, that's what you're going to learn. This is exactly how you can apply it. Now, this is kind of this is the syllabus, so to speak, of the class. That's a lot of stuff, right? We're not going to go through it bullet by bullet, but you can see we're going to be talking about endothelial function, which I didn't even get into today, right? Lipid physiology, B12 and homocysteine, all these other aspects. These are things that I can teach you, that you can learn during the class, that you can start applying. We can start talking about all these different lab testing, specialized lipid testing, looking at particle size and these other atherogenic particles, and management and treatment, right? Now, I'm not going to tell you how to use pharmaceuticals. We'll talk a little bit about that as the course goes on, but we'll talk about using transcutaneous vagus nerve stimulation, a lot of evidence-based, using different nutrients and supplements and phytonutrients, all of which are not brand specific, because look, I don't get paid by any lab. No supplement company tells me, pays me to promote them. I'm just going to tell you what the literature says and what I've seen work, and you can take that and pretty much use whatever you want. Definitely going to look at stress reduction techniques. I've talked a lot about the different types of exercise prescription, because you might want to use isometrics with a certain patient. How do you know when you want to do that? You might want to use something else depending if the blood pressure is high or whatever the whatever the condition is that you're dealing with. Some exercise is going to be more appropriate, more applicable. And then diet therapy, right? Because there's lots and lots of different diet things you can do. I'm going to show you how to do all of them. How to do Mediterranean diet, DASH diet, portfolio diet, gluten-free, intermittent fasting, time-restricted feeding. We're going to talk about all that. So with that in mind, that's what I wanted to take a few minutes today and really dive in and kind of pull the lid off the class and show you, say, hey, here's what we're going to be talking about, right? And here's why I think it's important for you as a practitioner to learn, because you've got people in your practice right now that either A, have these silent killers and don't know it, and you can be the person that picks that up for them and really save some lives. You've got people in your practice right now that are actively diabetic, obese, dyslipidemic, hypertensive, and you can change that for them. And of course, the fallout, the windfall of that is you're going to make their quality of life higher. You're going to save some lives, and you're going to make whatever rehab you're doing a heck of a lot easier. And I hope to see you guys in Florida, or see you live stream in less than a month. So if you have any questions, just contact the Carrick Institute about the class. They'll answer any questions you have, and I'll see you guys then.